Hey everyone, my name is Chad Westfall, and I am super excited to be doing this webinar with my good buddy, Justin Wedding. He and I met in a study group together, and we both just talked with each other, and we just realized that we were happy with where our businesses were. We were happy with how our team was. However, we just thought our clinical results could be better. And Justin and I, we went to a 2-day meeting in Nashville, and we were just blown away by the cases that we saw by Tom and Wasim. And we immediately signed up for the 2-year master's course. And it was super exciting to start getting these wow smiles in our practice. And today, I just want to share with you some of the results that we have been getting. And I'm super excited about it. So the title of my slide of my presentation is What's Pitts21 Has Meant to Westfall Orthodontics. I practice in Bristol, Virginia, and Abingdon, Virginia. In July, I brought on an associate because we were having some great growth within our practice. And this is my beautiful family. This is Caitlin, who is also my business partner. And these are my two boys, Jack and William. And I think another thing that Justin and I, a commonality that we really had is we were both very passionate about orthodontics, but our wives are play a very big part in our practice also. So I was trained at West Virginia University, and I really feel like I got an unbelievable education and really learning how to get teeth to fit together. However, I was never really taught anything about smile aesthetics. And now in my practice, these three slides my TCs have in all their treatment coordinator rooms. So we're always talking about smile arc. We're talking about vertical incisor display. And when you really want to get that vertical incisor display, that's when you have to really go to the SAP plus plus bracket positioning. And then also we talk about smile width. So I'm now focusing on these three things with added that I want a very good posterior occlusion where everything is socked in beautifully and the teeth are beautifully aligned very nicely. So this is Brittany, and this was actually when I signed on for the master's, the 2-year master's course with Tom. This was a case that I presented. And I now look at this case after 4 years of practicing pits, and I think I can't believe I would have considered extracting teeth. But with twin brackets, this was a case that I may have considered upper and lower fives. But when I went to Reno and Tom treatment planned the case, anytime you see that amount of maxillary crowding, you have to flip your brackets upper 2 to 2. So we knew that we were going to flip our brackets. We're going to run short class 3 elastics, and we're going to wear rainbow elastics. And when you look at Brittany, the one thing she really doesn't have much of a smile arc, and we want to be able to widen her, and we also want to be able to give her more vertical incisor display. Here's her Seth. And 5 months into treatment, at this point, I am in 2020 arch wires. Of course, upper 2 to 2 is flipped. I'm continuing just to wear the short class 3 elastics and rainbows. And what you can see on the lower arch is I have now started my doing some sanding in between the posterior teeth because of the amount of crowding that she had. And in 10 months, I just can't believe how quickly this case is going. But what I want you to really pay attention to is you can see that the brackets are higher in the anterior, but you really have to make sure that you get those brackets high in the posterior, especially in the premolar region, just so that way you're able to maintain proper torque in the posterior. And here we are at 14 months. Now, for me, being a twin base user, I was not, this case normally would probably take me 24 months, and I probably would have extracted teeth. But in 14 months, and just to see the smile change and just see how much incisor display that we now have, I was just blown away. And at the 14 months, this is when we removed the braces. And I would just really encourage everyone to get a spectralized laser because that is what really makes the smile pop. I mean, you can see the teeth are beautiful and straight, but we really have to get that gingival architecture in a lot better position. And so when I laser, a lot of times I like to get the patient 6 to 8 weeks back and just really let the tissue get really nice and healthy. And this is my first wow smile that I ever accomplished. And once you see it, it's very difficult to unsee it. And once you start getting these type of clinical results, it makes you excited to go to work. It makes you look forward to seeing just the progress that these patients have had. So once I got this result, I was all in on the PIT system because this was the most beautiful aesthetic work that I've ever completed with my hands. And I'd really like to show this lateral ceph because you could appreciate how much crowding that the patient had. But look at the axial inclinations of both the upper and mandibular incisors, and you can see that we've got the teeth really centered in bone. I think a lot of people would have thought doing this case non-extraction, the patient would have had a lot more flaring. However, I wanted to submit this case as for my reexamination for the board, just because I wanted to show them that we could aggressively, be able to get all these teeth to fit in together. And I would just really encourage everyone, a pearl that I would give you is, we really want to make sure that our upper incisor is upright. And I know that you can look at a ceph, but I would really encourage everyone to put a lateral smiling profile shot into their software because at every visit, every time I take progress photographs, I'm always looking at that photograph to see how the incisors are because I really do not want a patient to walk out of my office with flared upper incisors. This is Esme. So after I completed the master's course, I sent this case to Tom. Once again, as a twin user, I'm thinking, of course, this is a 4 bicuspid extraction case. And Tom kind of just laughed and said, Chad, not in my hands. So our treatment plan with this severity of crowding is once again to flip upper 2 to 2, run short class 3 elastics, and rainbows. Now, at the consultation, I'm also explaining to the patient that we do not want to extract teeth if we don't have to. However, I have to be able to weigh a way to create space. And in this case, obviously I'm creating space with the width of the arch wires, but that isn't going to be enough. So I also have to do interproximal reduction, upper and lower, 6 to 6. And you can see that she was already a little bimaxillary protrusive with that amount of crowding. It's pretty funny where Dr. Nan was my chairman at West Virginia University. I texted him and I said, hey, Dr. Nan, I'm thinking about trying to do this case non-extraction. And Dr. Nan just wrote me back, it's pretty heroic. So I was a little nervous, but of course I thought I really want to test the PIT system and see just how aggressive we can be with non-extraction cases. And the reason that I have this slide up right here is look at the posterior expansion that we got with these plus arch wires. And the patient was very diligent in wearing her elastics because look how those upper incisors stayed upright, but look at all of the width. And that's creating space in the posterior so that way we don't have to extract teeth. And in 9 months at this point, I am in the 2020 plus arch wires. We're continuing to wear short class 3 elastics until I can get those upper anterior segments completely upright. And if you look at in the upper left part of the screen, you can see as a result of wearing the constant class 3s, we're all little class 2 at the canine. But I'm not paying attention at this point to the posterior occlusion. What I'm focused on is I want to keep wearing that class 3 elastic until I can get those upper maxillary incisors vertical. And in 18 months, I removed the braces. And I love how her smile looks. Even though we were super aggressive in not removing any teeth, there was no compromise to her posterior occlusion. And we've got great vertical incisor display. She's got a nice, big, broad, wide smile. And I really think she's ecstatic now that she didn't have to have teeth removed. But I think when she's probably going to be the most excited is when she's 50 years old and she still has her full set of teeth instead of having 4 bicuspids missing. And once again, the lateral smiling profile shot, you can see, in my opinion, there is just a little bit of flare. However, I think it's very acceptable and I still think it looks very beautiful. But if I was being critical of myself, I would like to see those upper incisors just be a little bit more straight up and down. And here's her Ceph, and you can see with the amount of crowding that Esme presented with and how her teeth were already protrusive, we really maintained those incisors almost exactly where they were. And I think that is just the power of the Pitts system. This is Michaela. She was bimaxillary protrusive. She had good incisor display, but she really didn't have a smile arc to speak of. And we really wanted to be able to broaden out her arches. So you can see that she's class 2 on the right side. Class 1 on the left, you can see just how procline those upper incisors are. I was her 3rd or 4th consult because every other orthodontist wanted to pull teeth on her. And I said, well, I've got this new technique, maybe I can be able to do this, but you're going to have to wear rubber bands, very diligently for me. This is a Ceph showing the bimaxillary protrusion. And in 8 months, I just can't believe how great her smile's looking. Now, once again, when you go to the buccal occlusion shot on the right side, you would think, I need to start wearing class 2 elastics immediately. But I didn't because I kept wearing those short class 3 elastics until I got those incisors vertical. And in this case, I had treatment planned the case for upper 2 to 2 to be flipped because of the protrusion. But one day I direct bond my cases, or the cases I'm showing, these are direct bonded, and I put them on traditionally. But what's amazing is, and this is 19 months in, she's now, once I got the upper incisors nice and vertical, I then went to a class 2 elastic. But I was able to obtain that result and reduce the protrusion, and I didn't flip the brackets in this case. Now, how was I able to retract the upper anterior teeth? That was with IPR. That's IPR on the lower. You keep wearing the short class 3 elastics. You then get overjet. You'll then IPR the upper. And I am just loving how her smile looks. I mean, we have very nice vertical incisor display. She now has this big, broad, beautiful smile. And we've developed a nice smile arc. And she also learned how to smile with her time in braces. But for 21 months, for me to be able just to get the occlusion to fit together like that and just give smiles like that, I just have such a passion for this. I mean, this is so much fun. And, there are so many other experts out there. And I feel like with my Pitts journey, I'm just getting started. I know that I still have so much more to learn, but I am just loving the results that I'm getting. And once again, here from a smiling profile, you can see that we really did reduce the protrusion. We do have just a tiny bit of flare, but once again, that was operator error by me by being busy in clinic. It was treatment planned, and I placed the brackets traditionally, and they should have been flipped. And here's just the lateral ceph, just showing how we were able to reduce the protrusion and get the teeth into a healthier position. This is Jocelyn. As a twin user, I was always scared to death of open bites. You'd see the patient in the chair and you'd be like, bite, and they'd bite, and you'd be like, bite harder, bite. I want that bite to close. But with the PIT system, just the way Tom has his open bite protocols, I now feel so comfortable treating open bites with the PIT system. So when we have an open bite like Jocelyn, the one thing we're going to do SAP bracket positioning. We're going to place bite turbos or bite pillows on her upper sevens and talk to her about squeezing exercises. And Jocelyn had good incisor display. You could see that she was more gummy in the posterior. She really had a reverse smile arc. And we really wanted to be able to broaden her out. And just in 7 months, by just getting the brackets on the correct position, I'm just loving how her smile is already looking. And the reason I'm showing these intraoral shots is because if you think just the brackets and the wires are going to give you the beautiful result, you also have to understand the Pitts protocols. And one of the Pitts protocols is microaesthetics. So, obviously you can see that I have a height discrepancy between my upper ones. But what I'm really picking out now are the black triangles and just the shape of the teeth. So this is now when microaesthetics comes in. And you can see in 14 months, I've now done some IPR in the anterior just to really try to get my embrasures and just really get those long connectors so I don't end up with black triangles in the future. And in 16 months, this open bite that I had just looks absolutely beautiful. And I love how we were able to reduce her reverse smile arc. I think she has beautiful incisor display. Her smile arc looks great, and we have nice width to the smile. And I just kind of put these two slides right here because if you're really going to get the beautiful results that you want, you really have to focus on shaping the teeth and, really rounding and having your embrasures not be too large. You want your smallest embrasure between your centrals. Then you want the embrasure to get just a little bit larger between the centrals and laterals. and then a little bit larger between your laterals and canines. But for 16 months to get a smile like this, once again, I love clinical orthodontics. I have such a passion for this. This is so much fun for me. Like, so now on Sunday evenings, I can't wait to get to work and see how these patients are turning out. So it's been really great for me. And this is a Ceph that was just showing just the open bite. And you can also see how this upper incisor is nice and upright. And once again, with our lateral smoke smiling profile shot, you can see, we've got the incisors exactly where we want them, and her bite is beautiful, and I'm loving it. The next patient I'm going to show you is Jeannie. Jeannie, when she first came in, I had treated two of her daughters, and we finished treatment, and she goes, Dr. Westfall, at my age, I don't know if you can help me, but you know, I I really want to do something for myself. And I said, well, absolutely. And with Jeannie, you can see that she had the anterior crossbite and then also the bilateral posterior crossbite. And here's her Panorex, and here's her Ceph. But when you look at that maxillary arch, you know immediately, I think you really need skeletal expansion in this case. Or at least that was my first thought. And I talked to her about doing a Sarpy, and she said, hey, I'm really doing any type of surgery would be a deal breaker. And where she was 48 years old, I've done a lot of Marpies in my practice, but at 48, I just didn't know if we would be able to get the skeletal expansion that I wanted. So I said, well, Jeannie, I said, since surgery's off the table, I said, I've got these new brackets and wires. I said, let's give it a shot. So what I'm doing in this case is I'm flipping the brackets upper two to two. I'm going to put bite turbos on the lower sixes and sevens to disocclude her. And we're going to put cleats on the lingual of the upper fives and sixes. And you can see that just in 6 months, the bite has gotten so much better. And I think one of the reasons why we were able to get this bite corrected is with Tom's wires that he has. So I'm now in 2020. I'm just in broad on the lower, but I'm in plus plus on the upper because I know that I need as much expansion that I with wires that I can possibly get. And knowing how class 3 Genie was, I told you that I flipped upper 2 to 2. I wish I would have flipped lower 2 to 2 because I think as a result of all of those class 3 elastics, you can see that I'm starting to get stripping down here of my lower left one. So what I did is I sent her to a periodontist. He did a free gingival graft. He did a beautiful job on her. But in 14 months, look how the bite is jumped and there was no torque twisted in the wire. Just Tom's bracket and then also the square wire was able to get this expansion without getting that flaring that we fought with other appliances for so many years. And in 18 months, this is where we finished Jeannie. And she was just ecstatic. She loved it. On her, I did not laser because she had some attachment loss. And a lot of times when I laser, I would prefer just to laser on children just because, their bone and everything is just healthier. So I referred her to the periodontist about doing maybe some grafting in the area where there's root exposure. But I haven't heard back as far as what she decided to do. But she was just ecstatic with where her teeth were. And I couldn't believe I was able to accomplish this with just brackets and arch wires as opposed to a Sarpy. And I just really feel like this smile has just taken like 5 or 6 years and just rejuvenated her, made her look younger. And I'm just like, as a profession, like we get to do this. It's amazing. So she was ecstatic. Everybody in my practice was ecstatic. And I just couldn't believe that we could get these results with just the PSL pit system. And once again, the lateral smiling profile shot, a lot of times when you have cases where you're really wearing a lot of class 3 elastics, you see that where it always looks like your upper anteriors are over torqued and you have flare. But as a result of flipping the brackets, look how the incisors are nice and upright. And here is her pre-treatment ceph and post-treatment ceph. This is Kim. This is a fun case because Kim had been treated by another orthodontist and she had a little bit of relapse and she came into our practice and she really just wanted just some limited Invisalign. And I said, Kim, I can definitely do limited Invisalign on you. I said, but when I look at your teeth, I'm not seeing your full incisor. I said, I think I'd really like to be able to bring your upper incisor down. And then I also mentioned to her that I thought her upper teeth were a little protruded. And as soon as I said that, she goes, I told my previous orthodontist that I thought my teeth stuck out, but he said everything was perfect. And I think I've definitely finished a lot of cases like this myself. So I'm not saying that I would have treated this case better, but now knowing the PIT system, I know ways of how I can correct this. And in the past, I didn't know. I'd be like, well, it is what it is. So with her, we just know that when you can see the ceph, just how protrusive she is, we're going to flip the upper brackets. We're going to wear short class 3 elastics. We're going to do rainbows. And then we're going to do interproximal reduction, upper and lower 6 to 6. So that way there's room for these teeth to get more vertical. So here we are 10 months into treatment. You can see that she's showing a lot more incisor. Also, look at the buccal shots here, how now the incisors, instead of being protruded, are just looking so much nicer right there. And in 14 months, this is where we remove her braces. You can see just by getting the incisors upright, how when she smiles, we can see more of her incisor. We also did some extrusion, and I honestly probably could have positioned the brackets even higher on her, just because I would have liked to seen a little bit more pink tissue on her. But overall, she loved it, and we're loving these results also. And here is just an intraoral anterior, just showing before treatment and after treatment. And what a difference in her smile when we can see the full incisor. And of course, once again, always that smile, that smiling lateral profile shot, just always making sure that I have those incisors nice and vertical. And here's pre-treatment, post-treatment ceph. And this will be my last case. This is Megan. Megan, uh, at 14 and a half, she came into our office and she was still sucking on her thumb. And she really, when she came into the office, you could see we had hardly any incisor display. We've got the reverse smile arc. She has miles and loads of overjet. And when we talked to her, the one thing that we had to talk about is like, Megan, are we going to be able to stop this thumb habit, or do I need to put an appliance in? And, she was just very motivated. She knew that she wanted to get better teeth. So she was able to quit. And as a result of quitting the thumb habit, she made my job a lot easier to be able to treat her. And you can see just how protrusive her upper incisors are and just how much overjet that she had. And with Megan right here, you can also see that her upper, on the upper right side, the upper right five, we had a buccal cross bite. So with her, I kind of toyed back and forth. Should I flip the brackets or not? But with the amount of space that she had, I did not flip the brackets. I just put the brackets on normal. And 5 months into treatment, I just couldn't believe how this case had really kind of started to come together. But this is where, through Tom's teachings, I wanted to be able to get more incisor display for her. So my option for more incisor display is to go more gingival with my brackets. So you can see here, my brackets are probably about 8 millimeters on the upper centrals. I've done some IPR to help get the embrasures and everything looking very nice and pretty. And in 16 months, I removed the braces and we did get the full incisor display. And you can just see in her face, here's the Ceph pre, post. Once again, making sure that those incisors are nice and upright. But just now, how she just shows her full incisor, and you can just see just how much more confident she is with her smile. And I just can't tell you how much I am enjoying being able to provide this service to my patients. And I would just encourage everyone just to know that it's not going to be just the brackets or the wires that's going to make your teeth more beautiful, but you also have to have Tom's protocols. And if you put those three together, then you have this system that I really feel can give you beautiful results. So I will be presenting in Orlando, just kind of showing some cases. And this is my, my different handles on different social media outlets. Give us a follow. We'll follow you back. And if anybody's in Orlando, come say hey. And if you want to talk clinical orthodontics, I'd love to do it because that's my passion. So thank you guys for having me today, and I'll talk to you guys later.
What's up, guys? So honored to be with you guys here today. And, when Sophia asked me to do this webinar, I was kind of intimidated, but, knowing that I was going to do it with my good friend, Chad Westfall, it definitely enticed me to do this, especially for Dr. Pitts, who's my mentor and one of my orthodontic heroes. So glad to be with you guys today. I'm Justin Wedding. And what we're going to be talking about a little bit is my journey with Pitts Orthodontics, why I decided to make the switch, early in my career, but definitely a few years after I had been practicing for a while, and what it's done for my practice career. So a little bit about me. I attended residency at the Medical University of South Carolina from 2014 to 2017. I purchased a practice immediately outside of residency with my wife, Madison. I added a junior partner, Sam Thompson, in January of 2021. We have two daughters, 6 and 4, Ellington and Laurel, and they are as spunky as they possibly could be, and definitely the joys of our life. And my wife, Madison, is our director of operations at our practice, and she is definitely my superpower as far as our practice goes. And she's an amazing mom. So, once again, when Sophia asked me to do this, I felt a little intimidated. I felt kind of like this bodybuilder here. I'm standing up on the shoulders of these giants, Tom Pitts and Chad Westfall. Chad, his cases are amazing, and being a good friend of his and seeing what he's doing right now in this space is so cool. Of course, Wasim and Elias, the two wizards of Algeria, and there's me standing up there on the stage. But thanks to these guys, I've learned so much, and it's just incredible. What it's doing for our practice, and I'm so happy to be sharing that with you guys today. So my journey started with Chad in December of 2022. He's always encouraging me to get better and improve, which is why we're so close and such good friends. But we went to Nashville to a OC meeting, and we got the pleasure of meeting Dr. Pitts and just seeing what this system is doing. And from the very beginning, the two of us who love getting better, especially clinically, we were just hooked. And so at that meeting, we immediately signed up for the master's course. And so in March of 23, we started our journey. This is me. I love the broad plus wire, especially as somebody with narrow arches. You can see that headgear wire that we use in Pitts Orthodontics. But no, it was just so fascinating, and getting to learn from Dr. Pitts at the Masters was incredible. And so, whenever I think about something like this, I love analogies. And so for me, I want to show you guys two pictures that kind of tell a similar story. The left one is me graduating high school in 2007. And then the right one is a patient that I finished probably 3 years into my career. Sweet, sweet girl. And at the time, I was pretty proud of this result and thought that, this is traditional orthodontics. This is the best that could be done given her teeth and the size and shape and her face. And, that's the amazing thing about this pit system. And I'm going to go a little bit into this with you guys. So, why the heck did I show you a goofy picture of me from 2007? Well, this is the classic high school guy who my clothes were probably 6 sizes too big. I've got hair that hadn't been washed probably in a couple weeks. And, fortunately for me, the next year I met this beautiful girl, Madison, who is now my wife. And sometimes, we have things that are in us all the time. And so, you just need somebody to show you the way. So Madison gently encouraged me to get clothes that fit and get a haircut and start washing my hair. So, now you can see this guy that in 2007 had a belt that came down the middle of his knee is now a guy who, knows how to dress and clean himself up a little bit. But, Madison was just the person who showed me the way. So it was a similar journey with orthodontics. This is the patient that I'm speaking of. We started her, shortly after I started in practice. And this is the outcome that we got for her. Once again, at the time, I thought it was an excellent outcome. The way that I was trained in residency, putting braces on at the FA point, traditional MBT mechanics. And so I thought at the time that this was an amazing result, but we're going to go through a little bit about this because this is actually one of my master's cases. What is actually possible. And that's what's so special about not just the Pitts bracket, but the Pitts system is you're not only getting the best bracket on the market, but you're also getting a collection of people who are going to educate you and show you exactly what is possible. People like Tom Pitts, Duncan Brown, Wasim and Elias, and Chad Westfall, my good friend. So traditional orthodontics, once again, this patient's very easy case, mild to moderate crowding. We've got maybe a half step class 2 on the left. So we did traditional orthodontics. We put the brackets on at the FA point. We wore some rubber bands, And this is the result that we were able to get for the patient. And obviously, my profile shots got a little mixed up when we switched from Ortho Track to Ortho 2 Edge, but you can kind of get the picture on this patient. Not a bad result. This is, I think, acceptable traditional orthodontics, but this is not the wow that we're going for with the Pitts system. So what's so cool about this patient is, once again, if we're evaluating her through the Pitts guidelines, does she have smile arc? No. Does she have vertical incisor display at the appropriate level? No, she's actually in excess here. Does she have an adequate gingival display? Once again, that's a no. So the micro aesthetics going all the way down, she really doesn't hit any of the wow factors that we're looking for with the PIT system. And so that's what is amazing about this case is she came back into our practice right when I was starting the Pitts Masters course, and so I started seeing these factors for a wow level smile. So, what is the goal of the Pitts 21? These are the three big wow factors that Tom teaches us. Number one is smile arc. So, do the teeth follow the lower lip? Number two is the vertical incisor display. Are we showing the entire upper incisor, especially at this patient's age? Are we showing 100% of that upper incisor? And, that's really a big wow factor. And then lastly, do we have transverse width? Do the teeth fill out the dark buccal corridors? So once again, right when I was starting my Pitts Masters, this patient came back in, and I was so excited because I'm like, oh man, I get another shot at this. So, her chief complaint when she came back in the second time, actually, she had Googled and said, Dr. Wedding, I think I have mentalis strain. And so I educated her on how she had vertical maxillary excess and how, because of that, she was having to close her lips and it was causing that mentalis strain. So when I presented this at my master's course, I presented this patient. I said, she had previous orthodontics done, and my goal is to prove that I'm better than her orthodontist. And I love seeing Tom's face because Tom's such a humble person, and he looks at me like, "Who is this guy?" And then I paused for dramatic effect, and I said, "Who?" Which was me 3 years ago. And so Tom loved that, and it was just such a cool opportunity to say, like, "Hey, this is traditional orthodontics. What can actually be achieved with the Pitts system and the Pitts protocols?" So this is the patient Ceph, and you can appreciate that vertical growth and the excess vertical dimension. So with a patient like this, with the gummy smile and the excess vertical, first off, we're going to use the Pitts protocol. So we're still going to bond this patient for smile arc. The second thing that we're going to do is we notice that this patient is slightly flared to begin with. So we really want those upright upper incisors. And we know that with our intrusion mechanics that we're really going to be fighting against flaring. So we do want to invert the brackets. The Pitts inversion strategy for lingual crown torsion. We also are going to put bite turbos on the lingual of the upper sixes and sevens to help with arch coordination. So once again, this is a big pit strategy, and especially in the gummy smile intrusion cases, it's going to be really important that we put these bite turbos on the upper sixes and sevens to help with that arch coordination. So you see that we've put these brackets on with an SAP type of bracket positioning. And if anything, you'll see later on in this treatment, I could have gone a little bit higher with these. And for a gummy smile case, this may be a little counterintuitive to place the brackets so gingival for smile arc, but it actually is pretty critical. So on this patient, I'm going to place 3 TADs. We're starting with a TAD in the palate. We're going to use John Poban's dumbbell technique to intrude the posterior teeth. And then we're going to have 2 TADs in the anterior, either between the ones and twos or twos and threes. And that's going to help us intrude the anterior teeth. You can either hook elastomeric thread or power chain to the wire. Either is acceptable, and I have team members who do both, and we've had equally good success with both of these techniques. So here you can see where we've got the dumbbell wire bent through a palatal tad, and we have the two tads between the upper twos and threes here, and we've begun the intrusion for this patient. So continue with the intrusion. You want to start seeing this open bite. That's how you know that you're having success. In this case, you see where we're actually a little ahead of schedule as far as the anterior goes. We're starting to get a little bit of a reverse smile there, which is something that we'll have to deal with a little bit later. And once again, at the beginning, I mentioned that if anything, I would have liked to position these brackets a little more gingival. And where I was noticing our smile flattening out a little bit, I did a little laser recontouring mid-treatment so that I could position these brackets much more gingival. And so you see here where we've actually gone much more gingival in these brackets, SAP or SAP plus positioning. And so you can kind of notice where her smile is now we're starting to regain that smile arc. So, where we were starting to get a little bit of a reverse smile, we're starting to regain that smile arc with more of that SAP plus bracket positioning. So the other thing that we've begun doing with our gummy smile cases, and this is a tip from Ilias, is many times you'll notice that you're going to start seeing flaring in the anterior, especially if your team ties the thread or power chain even just a little bit too tight. So in this case, Ilias and Dr. Pitts suggested that I place some IZC TADs, and what this is going to allow me to do is get control of that flaring. So we're going to hook a power chain from the IZC TAD to a post right next to the upper threes. And so that's going to allow me to continue to get some anterior intrusion, but with a little bit of retraction of the anterior teeth so that we don't get that flaring. But the side effect of this also is that you continue getting the posterior intrusion. So in this case, you see now where we've got these IZC TADs in the posterior, and we're power chaining to a post on mesial to the canines. And this is starting to really make this smile look much, much better. We're still getting intrusion in the posterior, which we needed, but we're starting to get retraction and uprighting of these anterior teeth. And so you see over the next few slides how nice this smile is starting to look. So we're starting to get that smile arc that we're looking for, and we're starting to get those upright upper incisors that we're looking for as well. So this is the outcome that we were able to get for this patient. You can see we got the upper incisors almost perfectly upright. In an ideal world, I maybe would have done a little more IPR distal to her canines just to get them really perfectly upright there. We got a really nice occlusion, but the difference for her is the reduction in the gumminess and the wow factor. We were able to get the micro aesthetics, get the vertical incisor position, get the transverse width, and get that smile arc, and just create something so special for this patient. So you see this zoomed in view where we're hitting all of our targets as far as the size and shape of her teeth and all the smile aesthetics. So do we have smile arc now? Yes, I think we do. Do we have our adequate vertical incisor position and gingival display? Check mark. And once again, the difference in the micro aesthetics and making this patient look like they have veneered teeth. These are the exact same teeth that she started with, and that's the difference in the Pitts system and the Pitts philosophy. So once again, another shot at wow. It's just amazing that I got another opportunity at this amazing young lady to create the smile of her dreams, and that's exactly how she described it on Facebook. She said, "Thank you to Wedding Orthodontics and finally getting me the smile that I've always dreamed of." And you can kind of see the transformation here. This is my traditional orthodontics result when she came back, and then the final here, and it just This is something that we were able to show every single one of our patients. And it's so cool to have this because when people come in and they see the bracket positioning and that may look a little different than they're used to seeing, we just ask them, do you like this patient's smile on the left or do you like this patient's smile on the right? And 100 out of 100 times would they say, I want to look like the one on the right. And we say, well, then this is the Pitts system and this is the Pitts protocols and this is what we're able to achieve for you. So vertical excess wow smiles, let's put it all together. So this is another patient that came into us, once again, chief concern, and she knew that she had a gummy smile. He also noticed for her that she's very, very narrow and constricted. So we definitely are excited about getting that widening that we get with the Pitts brackets and the Pitts system. Here's a zoomed in version of her smile, and you can appreciate the gumminess, especially in the posterior, as well as the constriction. So here you see our bracket positioning. In this case, we used 4 TADs, 2 in the anterior and 2 in the posterior. In a case like hers where you need significant widening, 4 TADs is adequate, but I'm going to go through exactly what our typical system looks like. But you can see how much we've reduced her gummy smile. You can see how much we've actually widened her out with the TADs and with the expansion of the wires. And you can see that once again, this is a gummy smile case, but we position these brackets at SAP. We did not position these factoring in the gummy smile because at the end of the day, what we want is that wow. We want the smile arc. We want the adequate vertical incisor position. And so we do want to use the Pitts protocols and we do want to bond for smile arc. So this is her final result. Once again, so cool that with the Pitts system, somebody like me is able to get these amazing results. So, amazing occlusion. She's fitting together extremely nicely. You see her alignment, everything looks great. All of our details and the rounding of corners and the micro aesthetics is looking really nice. And you see the wow factor, which is my favorite part. You see the amazing width that she was able to gain. You see the smile arc following the lower lip. And, it's just such an amazing system that somebody as simple as me can actually get a result like this. So here's her before and here's her after. And, once again, this patient is just absolutely ecstatic about what we were able to achieve for her before and after. So here's my rules of thumb for excess vertical. Number one, the goals for a wow smile don't change. And so I've seen a lot of people that do gummy smiles outside of the Pitts21 system, and they're so talented. But I think many times what I notice is that their goal of intrusion is overwhelming the main goals that we're looking for in a wow level smile. So smile arc, this is the thing that I think is missed so often. I see a lot of the people who are doing tons of gummy smiles, and the result they end up getting because they're so focused on reducing the amount of gumminess is that they lose that beautiful smile arc. So that's why we say, if anything, you want to go SA plus on your bracket positioning because we want to make sure that we preserve a nice smile arc even through the process of decreasing the gumminess. Secondly, is vertical incisor display. So that's another thing I think I notice many times on people who do these gummy smile treatments is that they unintentionally will go past a good vertical incisor display because they're so worried about reducing or eliminating the gummy smile that they're not satisfied until the gum display is zero or even sometimes not seeing the entire upper tooth. So, we want to take photos at every single visit on these cases, especially so that we get to the point where we're showing an adequate amount of upper incisor and we don't over intrude. And then lastly is the transverse width. And this is something that actually with the gummy smile treatment is very easy to get because not only are we using the Pitts wires and system, but if we're intruding the posterior teeth, oftentimes what that creates is a lot of widening because the TADs are going to, and all of the mechanics are coming from the buccal. And so, that's why I'm going to get into a little bit why we use that palatal TAD occasionally. So for both of these patients, once again, I think that we did get a smile arc. We did get leave them with an adequate vertical incisor display. Both of them show a half a millimeter of upper of their gingival tissue on the upper, which I think is adequate for their ages. And then I think that we did get the transverse width on both of these patients as well. So number two, gummy smile treatment, flatten smiles. I've mentioned this a couple times, but make sure that you bond for smile arc. So with the Pitts system, Dr. Pitts has the SAP or SAP plus bracket positioning. And so in these cases, I think the more gingival that you can go with them, the better. And the goal of that is so that as these mechanics are designed to intrude and reduce the gumminess, we want to make sure that we don't lose that beautiful smile arc, which is something that oftentimes happens in these gummy smile cases. Rule of thumb number three, intrusion frequently can result in flaring of the upper anterior teeth. So we want to make sure that we flip the brackets. So, in the pit system, anytime that we know that we're going to be fighting against flaring, Dr. Pitts came up with a brilliant idea of inverting these brackets and introducing a negative torque. So that's going to help us keep these incisors and the crowns as upright as we possibly can. And so this is something that we've kind of combined, rule of thumb number four for many people between Ilias and the way that he does gummy smiles, and also John Pobans and his palatal tad with the dumbbell wire. So we like to use 5 tads. We use 2 between the upper ones and twos, and we typically are looking at 6 to 8 millimeters. We like to use 2 infrazygomatic tads, so those will be 12 to 14 millimeter tads. And then we like to use 1 palatal tad with the dumbbell wire. And the reason that we like to do this is because there's unintended consequences when you're doing significant amounts of intrusion. So anything over 3 millimeter gummy smile, where you're doing significant amounts of intrusion, the two unintended consequences of that you're going to get are number one, and we've mentioned this several times, flaring of the upper incisors. So the more that we're intruding the upper anterior teeth, the more we're going to start seeing some of this flaring. And so if we add the IZC TADs, that's going to allow us to control flaring of the upper anterior teeth. So we're able to keep those teeth nice and upright throughout treatment during the intrusion. The second thing that we've seen many times is, in a case that already has a nice transverse dimension and very nice coordinated arches, and we don't need significant expansion on, many times you'll start to see almost a buccal crossbite on these cases. And so we wanted to create a intrusion system that would allow us to also control arch coordination. And so with the palatal tad, we're able to control that arch coordination. So with John Poban's dumbbell wire, if we do see arch coordination issues where our upper is widening too quickly in relation to the lower, we're able to hook onto some lingual buttons on the upper fives and sixes, and that will allow us to continue our posterior intrusion without over widening the upper arch. And so that's been kind of a game changer for us to maintain that arch coordination. So once again, if we're intruding more than 3 millimeters, we like to have our IZC TADs in the posterior, and that's going to allow us to control the torque on the upper anterior teeth. And we also like to have the palatal tad with a dumbbell wire, and that's going to allow us to control over flaring of the posterior teeth as well. So we're able to kind of control the whole upper arch in all dimensions with these 5 tads. And so that's what we used on Kaylee. We ended up having to add the IZC TADs mid-treatment, to control the anterior teeth, but we did have that palatal tad with the dumbbell from the beginning. So we were able to really maintain an adequate width on the upper without over expanding her. Rule of thumb number 5, the bite turbos on the lingual of the upper sixes and sevens with Dr. Pitts' squeeze exercises also really helps support arch coordination. So we still do like to have those bite turbos on the upper sixes and sevens. When we start getting close to the end, we're going to remove them off the upper sixes and just leave them on the upper sevens. And that's going to allow us to really sock in the occlusion. So you see where we have those bite turbos. and that's also helping us with that arch coordination in the posterior. So on Kaylee here, you see where we had the bite turbos on the upper sixes there, and we did end up switching those to the upper sevens late in treatment in order to get her occlusion settled in nicely. Rule of thumb number six, and I think this goes without saying, but finish the job with a wow moment by lengthening the teeth with your laser at the end of treatment. So typically we will take the braces off and wait a month or two on the rest of our patients before we do the laser. But with these excess vertical patients who have just been waiting for this moment to not be gummy, we like to do the laser at the debond appointment. And the reason that we like to do that is we want them to have that moment where we take these braces off and they just go, wow, like this is what I've been waiting for my whole life, to show that less gum tissue and just have a smile that I'm so confident in. So we do the laser at our debond appointment. And so you see this patient, once again, she had the width and the smile arc and all the wow things at her debond. And on the left, you see what she looked like right before we did the laser. And on the right is what she looked like 2 to 3 days when she picked up her retainers. And you can kind of notice how it just seems to fill out those negative corridors just by getting rid of the gumminess in the back using our laser. So just an incredible result. And here's before and after the laser. So thank you guys so much for your attention, and I want to thank Dr. Pitts and Duncan and my good friend Chad, who's just such a superstar, and all the other amazing faculty at OC Orthodontics. It's truly changed my career. I'm humbled and honored to be able to represent this brand company, and especially my hero, Dr. Pitts here. Thank you for showing me the way. I'd also like to thank my beautiful wife, Madison. She loves and supports me through all of these things, and the time away from my family to learn from amazing artists and just get better at this craft. Without her support every day, I would not be where I am. So thank you all for your attention. I can't encourage you to do the Pitts Masters Continuum enough. Truly changed my career, and it's amazing to be able to create these wow smiles using the Pitts system and the Pitts protocol. So thank you all for your attention, and please reach out anytime if you have any questions.